to do an MET technique for the ribs, or in particular these lower ribs. The movement of the lower ribs acts a little bit like a bucket handle. So if you think of a bucket, the handle hanging off the side, it kind of levers up off the side. So we're going to use that angle to affect the MET. So let's assume that we have a dysfunctional rib, maybe some tight intercostals pulling down the rib, affecting respiration, or maybe giving some pain along the line of that rib. We need to identify which rib it is, and then we're going to run the webbing of our hand and thumb, or fingers and thumb, right around across both hands to create kind of a U-shaped ring around that bucket handle of the rib itself. So we hook around the rib, and then what I'm going to do here is ask my client to take a deep breath, breathes all the way in. That's it. As he breathes out and relaxes, I'm going to push that rib or compress the rib below the dysfunctional one down and then push up against the one above. That's going to elevate that dysfunctional rib up and create a compression against it. As he then takes his next deep breath, he's going to breathe out into my hands. So I want him to try to expand those lungs to push the rib out against my resistance. That'll be the resistance that we use for the MET. So hooking underneath it, pushing up into the rib, he breathes into my hands. I keep that compression on the rib, so not allow it to move too much. And then as he breathes out and relaxes those intercostals, I can then elevate that rib a little higher, keeping the downward compression, but also pushing up towards the shoulder, giving him a nice stretch into those intercostals. And then as he relaxes for a moment or two, he then takes another deep breath, breathing out into my hands. I maintain that compression on it. He breathes out, I sink, and then push up again and try to elevate that rib a little higher. And that's how we can use the MET concept to create more space between each individual rib and create a little bit more mobility for that rib as well. Thanks. Give that a try.